Now, why this is important is because when we look at the cells, all those little round things that you're looking at, whether it's light or dark field, those are red blood cells. And their job is to actually pick up oxygen from their surface area, from the lungs, and then they deliver that oxygen to the tissues. And then in the tissue, they pick up all the waste material from the cell's metabolism, and then they deliver that out the organs of elimination. Well, it would make sense to know that they need their surface area to be available, kind of like if you took a tennis ball and you dumped an individual tennis ball in a bucket of water, all the water is touching around that tennis ball. But if you pack in all the tennis balls you can possibly fit in that bucket, then the amount of water that's actually touching an open membrane isn't that much. And that's what's going to be a problem, and we're going to discuss that. If we use it in a way to be able to look at the morphology or the condition of the red blood cell, we can see free radical damage, we can see parasites, bacteria, and yeast, and we can see undigested proteins and fat. We also can see anemia. But the most important part that I use it for is to evaluate the fourth phase of water. Some of you out there who took science a long time ago, you're going to immediately say, what is she talking about? There's 3 phases of water. We learned that in school. No, there are actually 4, and I'll get to that on the next slide. But we talked about why these red blood cells are so important in order to deliver oxygen and get rid of waste material when they can use their surface area. This is a condition called Rouleaux, and I never really understood what was causing this, and Dr. Winter and I were taught that Rouleaux is normal in horses and cats, and I will tell you emphatically it is not. In fact, I posted a case in a technician group, and some guy actually made the comment, oh, Rouleaux is normal in cats. And I'm thinking, wow, a belief system? Yes. The truth? No. Because I can make this go away in a multitude of modalities in horses and in cats. So it is not normal. This is even worse than Rouleaux. This is almost called aggregation. And those are all supposed to be nice round blood cells. And you can see that they look more like cuboidal crystals and not a real white blood cell. This is a slide of an animal that has anemia. And the way we know that, scientifically defined, is that we have a lot of large cells and then we have a lot of small cells. And there's not that many cells on this slide. And by the way we make these slides, we take a fresh drop of blood, we put it on the slide, we put a cover slip, and we read it under 100x oil. So we're not adulterating it or staining it or doing anything else. We're really looking at the morphology of what's there. Now, the work I'm discussing is coming from Dr. Pollack, who is a very well-respected scientist at the University of Washington. And he's got tons of TED Talks. He's got a lot of stuff on YouTube. Again, very well-respected scientist who has really helped us understand the fourth phase of water. The fourth phase is a gel phase that lives between the liquid and the solid. And then he defined the space around the cell or the organelle as the easy water. And he called it easy water because it's the exclusion zone. And what happens is when this cell in the center, the little round part was called a red blood cell, it forms this structured water or fourth phase water, which is a negatively charged phase. When it is expanded, it pushes all of the positive solutes into that bulk water. This is an extremely stable configuration, and that's how he's able to explain surface tension in the water where bugs can walk across it, and also why clouds are able to stay together without dispersing. So this happens in our body. But when we are exposed to things like EMF, toxins, hormones, chemicals, pesticides, many things I've seen just crush that fourth phase of water, contract it down, and now the cells can no longer separate from the other cells around it, and that's when we see Rouleaux. So now we're going to show you a couple of cases. This was a dog on the left that came in, ain't doing right. We call it ADR. And you can see the blood cells were kind of stuck together and not looking really great. And then we did a PEMF device. I just want to show you how many different things can actually affect the fourth phase of water. And you can see in literally 24 hours, the blood totally different. This was a case I did of a dog before giving rectal ozone. And on the left, you can see a lot of aggregation in Rouleaux. We gave rectal ozone and then 10 minutes. And the only reason it was 10 minutes, it took me that long to give the ozone, put my stuff away, go get a needle, come back, set up the slide. And now you can see a dramatic difference. And these cells literally have beautiful energy and they're really nice morphology. You can just see that they, even if they bump into another cell, they don't stick to it. You can actually see them bumping and then just sliding right off. This is Popcorn. We're going to see Popcorn twice tonight, but this was Popcorn. He had inflammatory bowel disease. This particular day, he was vomiting, not eating. He had diarrhea. I'm doing a assisted lymphatic therapy on him. And this is a device that produces a microcurrent and inert gases and negative ions. And I do it all over the body. This was his blood on the left before I treated him. And then on the right was immediately following the lymphatic therapy. And that is such a dramatic difference. Just love watching that. This is little chunky 2-year-old kitty cat that had gone to a referral center for itching. And they gave him a shot of steroids. They used depomedrol. And less than 1 week later, the cat went into heart failure. I'm not saying it was due to the depomedrol. We don't really know what triggered it, but he went into heart failure. So the owner came to me, wanted to have something other than what the referral center was offering in the way of drugs, and the cat wasn't doing it, didn't feel good. So on the left-hand side, this is where I started with the live blood, and you can see not terrible Rouleaux, but not great looking cell morphology. On the right-hand side is after his very first treatment of lymphatic and our PEMF device. And what was more interesting than this is that clinically, he started eating, having more energy, he felt better. And every week when we do his treatments, he continued to make progress. When he went back to the cardiologist for a follow-up, the cardiologist did not know how to explain why his heart was improving. This was a cat that was very, very sick when it came in. And on the left, it really kind of looked more like a mosaic of crystals. It didn't even look like blood. We used our PEMF device. On the right-hand side was after 1 hour, and it still has Rouleaux, but at least we can recognize the cells now. This was before day 2 treatment. We did 4 consecutive days. And then after day 2, we could start seeing some individual cells, but it wasn't great. The magic was after our 3rd treatment. So we saw the blood right before we did the treatment, and then after the treatment, we had full cell separation. We did day 4, the blood remained looking good before and after, and then we checked 3 weeks later and he continued to look that good without further treatments. Little Suki went to a referral center for very severe vomiting and diarrhea. Liver enzymes are off the chart. They said Suki had severe liver disease. He probably wasn't going to live. And they got the vomiting and diarrhea under control. And then the referral center said, you need to go find a regular vet to continue the care. So Suki comes to me, and this was Suki's live blood. And you can see in the background, there is a bunch of bouncy stuff. That was fat that wasn't being digested. And Suki had been fasted already for 7 hours. So that should never have been there. Lots of Rouleaux, lots of fat in the blood. When I checked the triglycerides, they were 2,514. And that is exceedingly high by anybody's standard, human or otherwise. So we started doing a diet change. We started adding some enzymes, but really in 1 day, how much are you going to get done? And we used our PEMF device, and we can see that in the background, there is about 50% reduction in fat. He's still not fully converted over to a raw diet, but we're moving in that direction, and the cells look markedly better. Day 2, I didn't get the live blood done. This is day 3. And when I play this, pay attention to the background. There's some yeast in the background, but there's nothing bouncing around, and the cells look beautiful. In conjunction with that, we see clinical changes in the dog, which is cool when you're able to take something tangible and see the changes under a microscope and then correlate that with how the animal is changing. You know that's not just in your head and you're not making it up. So we started with triglycerides at 2,514. with all the fat in the rouleau. And 1 week later, his triglycerides were down to 125, which is normal range. And we used no drugs. All right. This is little Burger. Now we're going to do a change using music or frequency. And the frequency we were using was 444 hertz. So he really came in just for a wellness check. He was on his way to the University of Florida to have some little fatty tumors removed. And they just wanted to make sure he was doing okay. So we did his blood on the left and we saw a slinky in his blood and he looked terrible. And then we did the music and immediately after 10 minutes of music exposure, his blood separated. So my point here is to show you how many things can actually affect that fourth phase of water, which makes a huge clinical difference. This is Ratchet. He was 6 years old, a male neutered bully. He went to his vet because he had broken a tooth. The vet took the tooth out and it didn't stop bleeding. So they sent him to a referral center. The referral center did a workup and they diagnosed him correctly on a needle aspirate of his spleen and an ultrasound with having splenic lymphoma. So it's cancer in the spleen. This is literally how this dog came to me. He felt terrible. He had no energy and he didn't want to eat. This was his blood on presentation. Again, kind of like the cat. It just looks like sludge. And we did our PEMF device because I didn't know Dan yet. And in one treatment, we can start seeing the cells are breaking down to smaller clumps. We treated him for 4 days every week. And at the 3-week mark, we were able to get the cells to separate. And that's when he clinically started to make a big change. He started having more energy. He was feeling better. And then we were doing a lot of other therapies between IV therapies and photodynamic therapy and many other things, diet changes. And we re-ultrasounded him at the end of 10 weeks. And he was confirmed by a board certified radiologist to be free of cancer. He had no more cancer in his spleen. So he went from that to that. This little Michael, he was just eating processed foods and he wasn't doing well. And we did this change with our vitamin mineral mix. So just nutritionally able to separate the fourth phase of water. We started him, it was about a week before we retested the blood and you can see a dramatic change. This was a snake bite. This is one of the few times in Western medicine that they actually do live blood. And this are echonocytes, and this is a hallmark of a snake bite. All the blood cells get these little ridges and spikes on them. We did our treatments, including laser, including ozone, including antivenom. And within 18 hours, not only was the blood better, but all the swelling was down on the right-hand side. You can see 36 hours. She recovered fantastic. Here's Popcorn again. When Dana came, we wanted to actually do some cases together and see. So we were testing the 4-inch tower, the 5-inch and the 7-inch tower. So he is going to explain to us what he's doing with the tower. Now, Alyssa, my daughter, is holding the tower in her right hand and just aiming it at Popcorn. Get the sample.
Oh, let's see. Well, I'll just narrate over the top. I'll do a voiceover. So now what we're doing, see what we have the light tower vertical. We looked at the meridian lines of a dog and how they were going and moving. And there's probably more research we could do with regards to that. But what we want to do is we want to align the light tower, and we want that hashed line, I think if you can see that, in line with the energy, the flow of energy for the dogs. That's what we're doing. We're just treating the puppy.
So we did 10 minutes, did the blood beforehand, and then 10 minutes after. And Popcorn is on a raw diet, he's on all of the supplements, but he's also in an environment where he's exposed to tap water and she travels on airplanes a lot. This is a service dog for his mom. He lets her know when her blood sugar drops too low. And so he still has exposure to glyphosate and EMF and a variety of other toxics things that in the environment. So here's his blood on the left, his pre-treatment, and even his pre-treatment is still a lot better looking than most of the dogs that we see on an average basis that are eating processed foods. But you can see that he has probably a good 40 or 50% of his cells have just a little bit of toxicity. They have a little bumpy area around and not a lot stuck together, which is great, but they're not that big, beautiful clump cell. 10 minutes after the, 10 minutes after the 7-inch tower was pointing at him, that was his blood. And we just thought it was a remarkable improvement in 10 minutes, which can you imagine if you have this in your home and he was just immersed in this all the time and his blood could stay that good. This is Bruno, and Bruno's 4.5-year-old male Great Dane. And he has some polyps in his rectum, so he came in for me to evaluate that. And we took advantage of doing his live blood and treating him. And I think we also used the 7-inch tower on him. So he's also eating a raw diet. So his blood isn't as horrible as most of the ones that we see, but we certainly still see a good variety of toxic cells. And he's drinking mostly Dasani water out of a plastic bottle. So there's still a lot of toxins coming through that plastic, and their environment is not 100% pristine either. No EMF mitigation whatsoever. And then we did 10 minutes on the 7-inch tower. And again, it's a dramatic improvement to his blood. Then this is Lychee. This was a kitty cat that came in. Lychee was pretty much in the 11th hour. And we decided to do something with the tower. Now at that time, I only had a 4-inch tower. So we put the tower under the cat. And it was 45 minutes later that we tested the blood. I didn't have a 7-inch tower, but now that we've done several cases, I'm pretty sure had I had a 7-inch tower, this would have improved a lot faster. But we could see that a lot of cells separated and a lot of them did clump up and have a much better morphology, and the cat started feeling better.
Yeah, and I'll just say, it kind of, to me, this shows the difference in the strength of the light of the products. So, you know, I'm kind of talking about how much water going over waterfall, but it's also how quickly do you want to see a result. And these, you know, we're seeing the data here, difference between 10 minutes and 45 minutes. We did have one question about how to orient this, so I just want to hit that a little better. You want it to be in line with your body's energy flow, or in this case with the dogs or the cats. So above the heart, you want the hash line towards you or towards the subject. So whatever if it's the laptop here, going towards the laptop with the face towards that. And that's what we're going to use to treat this computer or the puppies. I think that hopefully, Jerry, that helps answer your question. I know that's a good question, and it'll come up again, and feel free to always ask anytime, but that's how we try to orient it.
We also laid the cat on it.
There you go.
You know, that was the other thing that we did. We had it still pointing through the head end, but many times we just had her sleeping on it, and we would have her on for an hour, and then we would take her off for a couple of hours, and then we would put her on again. And that's because we know there's an energy draw there. We know that we're physiologically affecting the flow. And when they're already depleted and they're already very stressed, you don't want to just take and burn your fire out. You know, like with acupuncture, you don't want to do too much. You want to lightly pump and make the energy come up. You don't want to just put a big log on and knock it off. So we were just doing on and off, and that was really helping her a lot. So this is our last case. This is Juliet. She's a Great Pyrenees that has been having problems with vomiting and diarrhea. And we did her which is on the screen. Didn't look terrible. And then we treated her with the 5-inch light tower. Saw some improvement. This was 10 minutes. But then watch this. After that, we did the 7-inch tower. And it is a dramatic difference from the pre and 10 minutes of the 5-inch. So this really helped me to solidify that the 7-inch really does have an effect over the 4 and 5-inch. I'm always looking for technologies and tips and tools that can help my patients get healthier, faster, and these towers are quite amazing. And EMF is just really one of the most devastating things that are affecting our animals. And you know, I've got tons of computers all over here. We have a lab full of equipment. We have technology monitoring and surgery. So they are inundated in an EMF field. Having these technologies inside which can help mitigate all of that for these animals is really priceless.